A shocking revelation has emerged from a recent report, shedding light on the controversial practices within a psychiatric ward for children and teenagers in Edinburgh. The report, which has sparked concern, focuses on the use of physical restraint and forced tube feeding in the Melville unit, a mental health facility catering to 12 to 17-year-olds. But what exactly is going on behind closed doors? The inspection, conducted by the Healthcare Watchdog and the Mental Welfare Commission, MWC, was prompted by a BBC Scotland's disclosure programme that exposed a culture of cruelty at a similar facility in Glasgow. This inspection is part of a series of visits to psychiatric wards, aiming to uncover the truth and ensure the well-being of vulnerable young patients. Here's where it gets controversial. The report highlights the use of restraint as a significant issue. While restraint is sometimes necessary, the MWC found that it was often used for nasogastric feeding, a procedure that involves inserting a tube through the nose into the stomach. The report suggests that this practice may not always be conducted safely or as a last resort, raising questions about the potential harm caused to patients. And this is the part most people miss. The National Safety Council recommends having up to 5 people present to safely restrain a patient, but the inspectors witnessed 8 staff members restraining a single young person. This incident, along with other cases, highlights the potential risks and consequences of restraint, including physical injuries and psychological trauma. The impact of these experiences is vividly described by Grace Vickers, a former patient at the Melville unit. She recalls the horrors of being restrained for forced tube feeding, a procedure she endured multiple times during her 2-year stay. Grace, now a student at Aberdeen University, suffers from complex post-traumatic stress disorder as a result of her experiences. She shares, "I still get nightmares. It never leaves you." The report also reveals that out of 661 incidents over 2 years, 533 involved the use of restraint, according to ward records. This alarming statistic, along with a whistleblowing report about the alleged overuse of restraint, raises serious concerns about the unit's practices. A critical question arises: are these facilities providing the safe and compassionate care that young people desperately need? The MWC's previous visits to such units were not considered official inspections, but now, in collaboration with Healthcare Improvement Scotland, they are taking a more proactive approach to ensure better patient care. Despite the concerns, the report acknowledges the dedication of the Melville unit staff and their commitment to improving care. NHS Lothian has responded by emphasising their commitment to addressing the report's recommendations and ensuring safe and effective care. They have introduced initiatives to reduce the use of restraint and improve record keeping. But the debate continues. Is restraint ever truly justifiable in these settings? How can we balance the need for safety with the potential harm caused by such measures? These questions are at the heart of this complex issue, and they deserve careful consideration and ongoing dialogue.